I'm Melanie Sampson. I'm the program director at the Clear Language Lab at Literacy Works. I'm here with my colleague, Sarah Glazer, senior program manager, as well as Tiara Whitlock, our program manager. We also have a special guest, Dr. Darcie Moeller, who I will introduce in a moment. Literacy Works is a Chicago-based nonprofit organization that advances access to information through our community literacy program, which supports the adult education sector, and our Clear Language Lab, which promotes the use of plain language, both through a social justice-driven lens. For the last several years, we've celebrated an institution that has shown leadership by prioritizing plain language, organizational literacy, and communication equity. This year, we are thrilled to recognize the Cook County Department of Public Health for their efforts. We have had the honor of working with CCDPH for the last year and a half through their health literacy initiative, and we've been thrilled to support the Organizational Health Literacy Toolkit project that launched in April 2025. And now I would love to introduce you to Dr. Darcie Moeller, our special guest for this year's conversation. A little bit about Darcie. Um, Darcie is a doctor and has an MPH and is an artist and public health physician, serving as the Health Equity Medical Director at Cook County Department of Public Health, where she leads the Health Literacy Initiative. Dr. Moeller is an associate program director for the Cook County Health and Northwestern University Public Health and General Preventative Medicine Training Program. She also serves as an attending physician at the Ruth M. Rothstein Core Center in the Sexual Health and PrEP Clinic. Dr. Moeller holds an adjunct lecturer appointment at Northwestern also, teaching public health practice for physicians and health literacy, communication, and systems change. Darcie, thank you so much for joining us, and we're excited to talk more with you.
Thanks for having me.
So yeah. Is there anything else you'd like to add in terms of your experience? Did we capture most of it, or is there
Yeah,
anything
I
else
mean,
you
yeah, I think that kind of covers it. I've been working in health literacy since, long before I actually got my MD, got interested in health literacy work, doing research after my undergrad yeah, so this is my jam. So I'm excited to be doing it in my career.
Awesome. I know when we first met, it was like, oh my gosh, we just connected very instantly. I think on a lot of the same values and areas of health literacy. I mean, I think about just even the name of your course you teach.
Yeah.
It like is exactly the things that we're interested in. So, uh, yeah. So I guess just tell us a little bit about the public health field. I guess, and for anyone who's maybe hears that term and I think a lot of people now have heard that term a little bit more in the last 5 years, but feel free to share a little bit about what public health means to you, what misconceptions you think people might have about public health, and why it's so important to our communities. Yeah, just would love to hear about
Yeah.
what
Yeah, I'll tell
what
you a
brought
little
you
bit
into
about
this
public
and what it
health.
means.
Okay, that sounds good. And I agree with you. I think if you asked me that maybe 6 years ago, there'd be a lot more people who are kind of like, the health department shows up at my restaurant. But yes, because I think COVID, really like emphasized what we do. Though there's still a lot that people don't really understand that we do. So Cook County Department of Public Health is the state certified health department for Cook County. For suburban Cook County, Chicago has their own health department. We serve 1.5 million people. We serve 127 different suburbs and over 700 square miles. So we have a very large jurisdiction for our health department. And we're also part of the Cook County health system. So that's a bit unique too, that we're a governmental public health department, but we also sit within a healthcare system. So that's got some interesting kind of overlap. But public health in general, it's really about keeping populations healthy. So where a medical doctor is working one-on-one with patients individually to help, help get them happy, they're thinking about, what medications they might need to be on, or what, they might need to do to prevent illness. Public health is focused much more on things like prevention and at a population level. So rather than having just one patient, we're thinking about how do we keep populations healthy. And that includes a lot of different stuff. There is regulatory stuff that we do, like inspecting restaurants, inspecting swimming pools. We do lead inspections at people's homes. There's a lot of communicable disease stuff, COVID-19, tuberculosis, a lot of different infectious diseases that we monitor. Um, and then there's a lot of work that I think people are a little bit less understanding about, which is like, why are we doing health literacy, for example? But a lot of our work is really centered around what is making us healthy or unhealthy. And that can include almost everything in your environment that you can think of: access to green spaces, walkable neighborhoods, whether or not there's gun violence to worry about in your neighborhood, um, the more traditional things: access to primary health care, public transportation. And really, all of those things fall under the umbrella of public health. Not that we're necessarily acting directly on those things, but we need to be aware of those things and sort of accounting for those things. So public health is a lot, but simply taking care of populations.
Thank you. Sarah, do you want to dive in?
Yeah. So, something that we've been working on together, Clear Language Lab and CCDPH, has been the Organizational Health Literacy Toolkit. It was in the works for a long time, but we just launched it. It's very exciting. So we'd love to hear you share a little bit about this idea of organizational health literacy. What does it mean to you personally, and how does it align with your work at CCDPH?
Yeah. Great. So, yes, it's been a long time coming, this toolkit that we just launched recently. It was very exciting. And it was really awesome working with Literacy Works on that project. Would not have happened without you guys. So, um, I will say on first and foremost, if you want to get lots of information, access the toolkit, you can go to healthliteratecookcounty.org. That's where you get the toolkit, and there's lots of different stuff down there. But I will just more broadly talk about health literacy, because that's really what it's all based off of. Most people, when they hear health literacy, they think of personal health literacy. They think of, is someone going to be able to like read well enough to understand medical information? If someone goes to the doctor, are they going to be able to understand what the doctor is telling them? Um, those things are true, and that is health literacy, and it's really what we call personal health literacy. At CCDPH, we've adopted the definition that was put out by the Health and Human Services. Um, it was the Healthy People 2030. Department of Health and Human Services does Healthy People 2030, and they put out two definitions of health literacy, separating personal and organizational health literacy, which I was super excited about when they did this. It came out in 2020, because I'd always had, and not just myself, but many people in the health literacy sphere always felt that the definition of health literacy didn't talk enough about the contexts that people are in, right? So if you think about me, I'm a physician. I have a lot of education. If I go to the doctor, I have a leg up on being able to understand what that doctor is telling me about. But even with that, I'm not a kidney doctor, right? And if I was to go, if I was diagnosed with kidney disease and I went to the kidney doctor, I would be lost without them explaining to me in plain language. Medical school was a while ago now, right? So even my health literacy is depending on the context that I'm in. So, so organizational health literacy, to get back to the fact that there's these two different definitions that they put forward for Healthy People 2030. Personal is talks about, what are my skills? What are the individual skills and abilities? What can they do? But the organizational is, how is an organization enabling people to interact with the services? So the easiest example that I hear all the time is people saying, "Oh, well, is this written at a fifth grade reading level?" And so that's gotten into the public consciousness, which is awesome, because that is an organizational change that you could make. You could make sure that all of your written materials are at the fifth grade reading level. We could argue whether it should be lower or higher, or whether we should use reading levels, but just to be, as an example, that's something the organization can choose to do to serve the most people. So to me, organizational literacy health literacy is not just things like that. It includes things like that. What little things can we do to make sure everybody can access it? But going even farther, right? What if you have clinics that are spread out all over suburban Cook and they're miles away? How are people even getting to your clinics? What access to transportation do they have? Um, do you just hand someone at the end of their visit a handout of what you talked about? Well, that's better than nothing. So I don't want to poo-poo that. That's good. That could help with their personal health literacy as long as they could read it, right? But who knows what other things are going on in their life on whether or not they'd get to act on any of the if first they have to be able to understand what it says, and then they have to be able to act on it. They might not have access to good healthy foods. And if they have a handout telling them you need to eat X, Y, and Z for your diet, but they don't have those things, well, you're not really making an impact. So, really at CCDPH, our health literacy initiative, like we have a very sort of central purpose, which is to increase health equity in suburban Cook County by transforming our public health system based on health literacy principles. So that means making the systems easier to navigate, right? So with every program that we design, we want to think about how do people access this program? Are the right people getting access to this program? Are we promoting this program in the places where our priority communities are, whether that's physical spaces like churches or community centers, or digital spaces like social media, you know, are we in the right places for people to see the information we're trying to put out? Or is it culturally competent information? Is it readable? All of those things. Is it in the right languages? All of those things. So are we, making sure people can find it, then people can understand it, and then people can act on it. And we're not thinking as much about personal. We're not going, oh, well, let's go to schools and teach everyone about, the detailed information about medical conditions. That's a piece of it. I think it'd be great if we had really good health education. I think we should have really good health education. But those social factors those social barriers are always going to be there. So what are we doing to take away some of those barriers?
Hearing you talk about access, I think it's great that your team has been highly supportive of the role that community health workers can play in expanding public health services. So could you talk more and tell us about the importance of integrating community health workers into your work and how it connects to organizational health literacy?
Yeah, absolutely. Yes, we're doing lots of work with community health workers over the past few years in particular. Um, I'll start by saying I'll start by saying what a community health worker is, just in case there's anybody in the audience who doesn't really know. Community health worker is doesn't require any formal education, really, at least not at the moment. There are community health worker training programs, which we could talk all about if we want to, but essentially it's a community member. So it's someone who is from the community that you are intending to sort of prioritize or communicate with, or at least has some sort of deep knowledge of that community. So for instance, if I was looking at, a certain region wanting to increase vaccination rates, in Harvey, then I would want to have a community health worker team based on people from Harvey, because those are people who live their daily life there. They know what barriers are there. They speak the same language, whether that's, not the actual language, right? Like English versus Spanish or versus whatever, but also just cultural language, right? Me going into that community and saying, hey, I got this vaccine for you. Here you go. You should take it. Isn't really going to mean much. I don't have a trusted relationship there, even if I would like to, or even if I feel like I'm being trustworthy. So community health workers are trusted messengers of health information. They really serve as connectors. They're vital connectors of people of community, right? People in the community to healthcare, health services, or social services, right? So that they can serve as that linkage. They can also serve as a navigator. Our health system in general, social service systems, these are all highly complex and really difficult to navigate. And while I want to work with those organizations myself to help them make the systems less complex, in the meantime, people need help navigating these complex systems, and who better than a community health worker to do that? Um, so so that's community health workers, why I see them important. I relate it really to organizational health literacy, in case that's wasn't clear from what I just said, is that they are a piece of people being able to find, understand and use health information and services. So they literally, like, their role actually helps with facilitates all of those things. So to me, that's the connection. We have been doing a lot of work supporting the community health worker workforce, and not just CCDPH, but this is the lot of organizations in Illinois right now, and nationally. So we received a grant from the Centers for Disease Control to support community health worker workforce. So hiring community health workers, training community health workers, thinking about sustaining of that workforce. Community health workers have been around for a very long time. But getting sort of organizational buy-in and money to pay for community health workers is not always available. But there's been some recent movement. I'll just name two things real quickly. One is that there is the 1115 waiver, which is expanding Medicaid coverage for health-related social needs. So this is authorizing Medicaid to cover things like housing services, support and food, nutrition, things like that. So Medicaid's going to be able to bill for these services probably sometime in early 2020, starting in early 2026. So that provides a vehicle by which we can start billing for the services that CHWs provide. So, for better or for worse, probably for worse, we live in a fee-for-service, healthcare system. So the way that we fund medical care in general is by billing insurance. So the fact that we're going to be able to bill insurance for CHW work is a game changer. Now, it won't be enough to cover their salaries. So there's got to be other funding streams, but it's a huge step. Another thing is that there's a community health worker review board that's advising the Department of Public Health on how we would certify CHWs to make sure that there's a standard. So it brings me back to that saying they don't need special education, which is true. But there is definitely skills, both basic and advanced skills, that CHWs can benefit from and will only do better with. And so the Department of Public Health is thinking about what skills need to be sort of that baseline so that we can have CHWs who are certified, and then those ones will be the ones who will be able to likely bill for services. So lots of interest right now in CHW work, which I think is really exciting for people who have been working in this area for a long time, sort of without any real funding or support.
I feel like I've learned so much about the community health worker world working on this initiative. And it's such an important role, as Sarah and Tiara and I have all worked in different sort of other nonprofit organizations and community-based settings. And so often a challenge that I know we've all talked about and encountered is just how people helping connect people to services outside of your program. I know that in adult ed, it was, I used to be an adult educator, and so many of my students, like, to come to class, they had to deal with all these other things and get them taken care of. And I think we could see the vital connections between those things, but not everyone has the capacity to be like, okay, let me help this person also do these 10 things they need to do and walk through it with them. If we could have more of those roles, especially the trust part, I think that is so important. So it's really exciting to hear that this is this work is continuing to grow and move forward. So it's so important. um, Speaking about the toolkit, one thing that if you go to healthliteratecookcounty.org and you download the toolkit, you will see that it is beautiful, and a big part of that is the work that you put into this, Darcie, of connecting the importance of the imagery and the creativity of it, and just the appeal of it. So I'd love to hear more about just how you see the intersection between art and public health and organizational health literacy. Like, how do you see those connected?
Hmm. Yeah, I think that's a really interesting question. Interesting because I hesitate to say it's critical because not everybody's going to be an artist, but I do think that everybody can think creatively. Um, so yes, I did do the artwork for the toolkit. I love making art. That's the whole, I used to say, oh, I used to be an artist until someone corrected me and they said, no, you're still an artist just because you're doing this now. So, um, I love to do it. I also think that there's a lot of commonality when I'm making artwork for things like this, anyways. That's really about like, what am I communicating? Right. So communicating with words or communicating with images. And I also love the idea of communicating with images and like testing with users what they understand from those images, because you may or may not be communicating what you think you are with a particular image. They can mean different things for different people. But I'm just sort of fascinated by all of that. But of course, if we use images, it totally omits the need for that cognitive load of being able to like read and understand and comprehend. And people of all languages can look at an image and may be able to take away the same things. So yes, I do love visual art. As far as like how I think this applies sort of more broadly to the work and organizational health literacy work, I think that thinking creatively and out of the box is important. Um, I don't know that I have a good example, um, but I think just if you think about like all of the different things that you can do to improve a process and put yourself in somebody's shoes and think about how they might. So if we're designing a program where someone is going to go and access, STI testing, if you can put yourself in their shoes and think about what process they're going to follow to go and get that testing to engage in your program, um, you can find sort of a creative way to think about that is to imagine each part of the flow, right? That they're going to like that they're going to encounter on the way. Um, you can also think by like, okay, who else could I bring onto my team, right? Rather than having it all be on me, then I'm going to think outside of the box of the people I'm going to bring on. Like maybe all the people who are in my group don't have the lived experience, have never gotten STI testing, or are not part of this group that we're targeting, right? So being creative about like the people that you're bringing in and the voices that you want to hear from. So I don't know that it's a one-to-one, like, you're an artist and a creative type, and so then you do this kind of work. But I do think that thinking creatively and outside the box like only helps when you're trying to think about interventions that might work, because a lot of times with this stuff it's trial and error, right? Well, let's try this, let's try something different, you know let's not just keep giving people handouts, try something else.
I love that. I think coming from the adult education world, I really like loved this approach and in getting to work in this kind of space, because I think we see like the way you can layer information or scaffold information and just give different opportunities for input, while at the same time really trying to reduce the cognitive load for people is just, I think, expands the possibilities, right, of what people can have access to and feel like is about them or relates to them, or they're open to connecting with. So, yeah, this has been a really wonderful, I think, lesson for us too, of just getting to see um, how to model the things that we talk about doing all the time in this work. So um, big fan. If you haven't checked it out yet, it's really beautiful.
Yeah, I agree. And I think to the idea that like being an artist and thinking creatively are not the same, right? And that anyone can think creatively, and that it is such a powerful way to address the different challenges that we are all trying to address, and to the ways we're trying to make the world better, right? When we think creatively and outside of the box, we're able to address things in a new way and have successes in places where we didn't before. So I appreciate that perspective. And so kind of thinking about that, we've talked about some of the projects that we've worked on, some things that CCDPH is doing. What are some of the wins that you've seen in the public health field in suburban Cook County that you're excited about?
Mm. Yeah, so I think I'm thinking about when you say that I'm excited about, I'm thinking about current events. I will say that currently we're going through a really difficult time. Public health is going through a difficult time. Potentially even more challenging than COVID was. And you know, I'm early in my career. I started my career during COVID, um, and my public health career. And I think that the environment that we're in um, can be downright hostile towards public health. And yet, what I've been calling the sort of silver lining to all of this is that I have been really pleasantly surprised and impressed and excited by how much people are really banding together. And when I say that, I don't mean necessarily, you know, people on the street going to protest things, which I think that's great too. But I mean organizations really pulling together. We had a situation where we were unable to continue providing funding to some of our organizations because of a grant being cut. Um, and the reaction, uh, by and large, was, what can we do to help? Right? Um, you know, how do you think we can continue to work together? I want to continue to work together. Um, a lot of talk about sustaining our work, which anybody who understands how grants work, you know, grants are temporary. So this was already going to be temporary work, but we were relying on it for a longer period of time. And I kind of expected people to, these organizations, these community organizations that I'm working with to feel really defeated and um and sort of, yeah, defeated, dejected, potentially even upset with us, even if it didn't come from us. But it couldn't have been farther from the truth. It was sort of like empowered and emboldened and thinking, how do we collaborate even more? So I think I wouldn't say that I'm in like in an optimistic period of my life, of the world right now, but I am very excited to see what happens in the future, because there's so many people who have been doing awesome work, who may or may not have to put some of it on hold, but who are damn sure going to return to it when they're able to, and take all of these lessons learned that we've been like, you know, really working so hard on these last few years, and just run with it. So um yeah, I think to me that's like what I would say has been sort of most exciting for me lately. That, and like all of this stuff around the CHW certification and Medicaid billing, because um, that is something that has been, I think, in people's dreams for a very long time, and I'm seeing it come to fruition probably next year. So that's exciting too.
Thanks for sharing so much, Darcie. I appreciate what you said about people being energized to like continue, and even if they can't continue in the work, to know I'm not going to forget about it, but I'm going to return back and finish what I started, so to speak. So I appreciate that sentiment, because I know it is kind of rough, not just in the health sector, but a lot of different places right now. So just to have that reminder that we have to pivot right now, but we could always come back and finish what we started and keep the main idea in our hearts if we can't keep it in our hands. So thanks. Um, is there anything else that you would like to share about your work, organizational health literacy, plain language, or communication equity? Anything you feel like we didn't touch on? You've shared so much, so much wisdom. Is there
I know I
anything
talked a
else
lot, didn't I?
that
I
you'd
don't know
like
if
to leave with us?
it's like something to leave you with. Um, I loved what you just said. What'd you say about we could keep it in our hearts even if we can't keep it in our hands?
In our
Beautiful.
hands.
Yeah, I like that. Um, I think, I would just say you're not asking for this, but I really would say that I appreciate Literacy Works through this whole process of all this health literacy work that we've been doing. Literacy Works has been an awesome partner. They're not paying me to say this, so but I just want to say that, like you guys really care about the stuff that matters and assisting organizations and people with the stuff that matters. Like I think, obviously health literacy is my heart and to me is like my mission in life to address and to find people who are walking alongside me is really refreshing. And that's another thing, I guess. I'm going to add it. I'm going to go back to Sarah's question. I'm going to say that's another thing I'm excited about is these new partnerships. And I'm excited to continue these partnerships and see what other things we can achieve together. Anybody who's watching this who wants to be a partner in this work as well, get in there. Get on our website, contact us.
I love that. There's always work to be done. Um, Well, thank you so much for joining us, Darcie, for this conversation. And I can't speak highly enough. It's been such a pleasure working with you. I'm excited that we're continuing to work together. It's been such a joy, and I just feel it's such important work. So thank you to you and also the team at CCDPH. It's been wonderful to get to connect with a lot of the different folks that work there too. And we're just thrilled to raise up the work that you're doing to advance health equity and grateful for the relationships and the connections we've been able to make with you all. So thank you so much. And we'll keep doing this.
Sounds great. Thanks, everybody.